Go with the story.
Researchers here in California have used AI to find a number of risk factors in patients' health records that eventually pointed towards Alzheimer's years later. They took the electronic health records, think everything from the form that you fill out as you're waiting for your doctor's appointment in the waiting room to the actual notes that that clinician takes during that doctor's appointment to document your health. And they took all of that data, made an AI model that could go through all of this data and found predictive risk factors 7 years ahead of an Alzheimer's diagnosis. Now, it even found different risks among sex. In female, osteoporosis was a risk factor, males, erectile dysfunction, and enlarged prostate. In both sexes, high blood pressure, high cholesterol, vitamin D deficiency were also among the risk factors.
We can use a clinical profile to be able to predict whether somebody might have a chance of developing Alzheimer's at about 70%. This is not perfect. This is trained on data at UCSF. How applicable it is to other hospitals, we need to test through various clinical studies and clinical trials. But it's a starting point.
Now, this doesn't ultimately mean it's as simple as you have low vitamin D, you're going to get Alzheimer's. It's not that in the slightest. We don't have the data for that, quite frankly, or the research, but it does start to pave the way for AI tools for clinicians. This actually builds upon other AI uses currently being researched as well. For example, artificial intelligence can look at brain scans, PET scans, and detect Alzheimer's years earlier.
Now it's a lot of the safer ways of, like maybe screening patients, maybe kind of thinking about different diagnoses for patients, going a little low risk. And then for the higher risk, we do want more guardrails in place. We don't want to do something wrong because of an AI model.
Now, again, this wasn't 100% certain. So first, there need to be more clinical trials looking at patients, following their electronic health records instead of anonymous ones, which is what was used here. But AI models like this could be tools in that back end on the clinical setting, perhaps finding all of these different data points about one of these risk factors for a new patient, and then prompting a doctor to ask more about their medical history. Lindsay Thies, Scripps News, San Francisco.